Hello and welcome back to the EquiHerbal podcast, where we discuss all things herbs and horses to help you and your horse live a happy, healthier life, naturally. I am Kayla Dendy, your master herbalist, and today I will be discussing black cohosh, an herb whose claim to fame has been for women's health. As always, please speak with your doctor or veterinarian before utilizing herbs or alternative medicine. This podcast is for informational purposes only and is not intended or designed to be a substitute for qualified medical advice. Introduction. Black cohosh is one of the top-selling herbal supplements in the United States. Black cohosh is predominantly used by women for hot flashes and mood swings associated with menopausal symptoms. However, in my opinion, black cohosh is primarily a nervine instead of a female tonic. When the plant is flowering, it exhibits a strong, off-putting smell that makes it an effective insect repellent, earning its common name of bugbane. The botanical name of the plant, Cimicifuga, is Latin for bug repellent. Black cohosh has had a change in its botanical name. It was formerly known as Cimicifuga racemose, but is now known as Actaea racemose. It takes the plant 4 to 6 years to grow before it can be harvested for medicinal use. 97% of black cohosh is wild-crafted, meaning that it is gathered from wild resources and is not commercially cultivated. The annual harvest of the plant ranges between 500,000 to 700,000 pounds, which places a huge strain on the supply and is a cause for concern about the continued use of the plant. Black cohosh is currently on the at-risk list. In general, this means a plant may be doing okay in some areas of its natural range while being over-harvested in others. Plant description. Black cohosh grows wild, a tall-growing woodland perennial of the buttercup family, native to the United States and Canada, mainly east of the Mississippi. It grows best in shady and rocky areas, such as rich woods and hillsides. It can be grown as a background plant for a border garden of hardy perennials, or in a wild garden. Since it is a hardy plant, it requires no special care. Black cohosh is an herbaceous perennial, tall and leafy, with large, thrice-compounded leaflets, often deeply toothed. The stem is unbranched, slender, smooth, and furrowed. The stem is 3 to 8 feet tall and leafy. The leaves are alternate, with long petioles and thrice-compounded leaflets that are 1 to 2 inches long. The leaves are oblong and deeply toothed. The leaflet ends are often compounded. It has a lot of flowers that are feathery, white, small, and regular. The flowers are nauseating in their smell. The flowers are 8 to 20 inches long with petal-like sepals that fall early. The seeds are borne in dry oval pods, with the seeds in 2 rows. These seed pods give the plant its nickname of black snake root because of the way the seeds rattle inside the seed pods, producing a sound similar to a rattlesnake. The root is straight, stout, and dark brown, hard and knotty with hard, rough nodes. The root is horizontal 4 to 5 inches long and 2/5 to 1 inch thick. The roots are slightly annulate, with circular scars of bud scale leaves, and an upper surface with numerous hard, erect, curved branches, terminated by deep, cup-shaped scars showing a radiate structure. The lower or lateral surfaces have numerous root scars, a few short roots, and a horny fracture. Internally, the root is whitish and mealy, or dark brown and waxy. The bark is distinctly radiate wood, with a central pith of the same thickness. The roots are cylindrical, obtusely quadrangular, 1/23 to 1/8 inch thick, and 1/4 to 4 inches long, brownish or blackish in color and longitudinally wrinkled, with a short fracture. The internal cortex is thin, brownish, and has a yellowish wood with 4 to 6 rays. The dried root is purplish black or brown black, with a slight odor and a bitter, acrid taste. The root, when powdered, will be light brown in color. Parts used. Most herbalists use the root and rhizome of the plant for medicinal purposes. History. Black cohosh was used by early American colonists for yellow fever, malaria, bronchitis, dropsy, uterine problems, and nervous disorders. In traditional Chinese medicine and traditional Japanese medicine, black cohosh was considered a female remedy that was used to release the exterior, clear heat, relieve toxicity, and raise collapsed yang. Black cohosh has been used therapy for pain and inflammation in Korean folk medicine. Black cohosh was a mainstay in North American Indian medicine as a woman's herb, used for relieving pain during the menstrual period. In fact, it was, according to an Indian medicine guide of the late 18th century, one of our very best remedies in a great many womb troubles, and was a standard remedy for American Indian midwives. It is said to be the specific remedy among many tribes for menstrual pain, especially for facilitating and regulating childbirth. The bruised root, applied to the wound, was used by the Indians as an antidote for snakebite, with the juice in small amounts taken internally, apparently by chewing bits of the root. Introduced into the medical world in 1831 by a Dr. Young, it was used as a cardiac tonic for chorea, bronchitis, rheumatism, women's ailments, and other minor problems. Its principal medicinal constituent, simicifugan, is a potent remedy, and therefore the herb should be taken in small doses. Simicifugan is considered to be macrotin, the famous remedy of the eclectic school of healing. After its introduction into the medical world, was for a time often used and much valued in the late 1800s. Black cohosh was made famous by Lydia Pinkham in the 1800s. She is credited with about 1/3 of the population of the United States. She sold a tonic that was labeled vegetable herbal compound, but everybody knew it as a baby in every bottle. The active ingredient was black cohosh. Although it had helped thousands of women, Lydia Pinkham's formula fell into disregard by the medical establishment until the discovery of estrogen and the fact that the plant appeared to contain estrogen. Constituents. Black cohosh contains more than 20 different triterpene glycosides. Early reports of the phytoestrogenic isoflavones formonetin and biochanin A have not been substantiated by recent analytical data. Black cohosh also contains aromatic acids, novel polyphenolics. The plant contains approximately 20% resins, notably simicifugan, which is one of the more studied components of the plant. Clinical uses. Black cohosh works directly on and calms the nervous system. It has been used effectively for cases of spinal meningitis. Black cohosh is used as a tonic for the central nervous system and is regarded as a nervine. It is an excellent safe sedative. It has been reported to be good for medulla oblongata damage caused by hallucinogenic drugs. The herb relieves and prevents spasms, and has been used for epilepsy cases. Because of its action on the central nervous system, it has been used in cases of headache. Nervine herbs such as black cohosh can help rehabilitate an exhausted or damaged nervous system. Black cohosh, as a nervine, feeds, regulates, strengthens, and rebuilds the nervous system. It acts directly on the spinal nerve, especially influencing the smooth muscles which are found in glands and the digestive tract. In more serious nervous system ailments, black cohosh has produced good results. It is often used in cases of chorea, St. Vitus's dance, to allay the symptom as well as heal the nerves and remedy the disease. It has been used effectively in epilepsy. It should be noted that only alcohol extracts can extract the antispasmodic values from black cohosh. It promotes menstruation, relieves menstrual cramps, and has been used for the after pains of delivery. Black cohosh contains natural estrogen, the female hormone, and is a specific remedy for female problems. Black cohosh remedies both amenorrhea and profuse menstruation, as well as painful menstruation. It will relieve cramps within 15 minutes of ingestion. Black cohosh can help to restore a missing period. The herb can help relieve PMS, side aches sometimes associated with ovulation and/or menstruation, and an atonic, weak, or involuted uterus. It also relieves the aching in the ovaries felt during menses. Black cohosh can be valuable during pregnancy. It can help to tone the uterus and prepares it for conception and a healthy pregnancy. It relieves the soreness and tenderness of the pregnant womb, which is sometimes aggravated by walking or climbing downstairs. It can help to relieve the soreness and tenderness of breasts during gestation, taking small doses during the pregnancy, and it contributes to a short, easy, and uncomplicated labor. If you are considering taking black cohosh during pregnancy, please consult with your healthcare provider before doing so. Knox, a medical practitioner, noted the action of black cohosh during childbirth in well over 100 cases. He concluded that the remedy relieves nervousness in a parturient woman, quieting irritability, nausea, and overwakefulness in the first stage of labor. It is especially useful in many cases of false labor, as it quiets false labor pains, yet stimulates regularly true labor. It was considered much superior to ergot, which produces constant, strong contractions, and which might prove less effective in subsequent usage should it be needed. Black cohosh produces natural, intermittent contractions, stimulating inefficient, feeble, or irregular contractions to normal action. However, if given in large doses in the first stage of labor, it may terminate the labor for a time, without, however, harming the fetus. After delivery, it maintains good contractions to expel the placenta. It is said to be the best reliever of the after pains, and it calms down the new mother from the excitement of the birth. However, it does not ally hemorrhaging after birth, and one Dr. Coffin, after limited observation, concluded that it might relax the tissues so much as to cause hemorrhaging. This, however, has not been proven. For the depression that sometimes occurs after birth, black cohosh seems to be an almost miraculous specific, perhaps because of its hormonal content. An English doctor in the late 1800s, Sir James Y. Simpson, related that a mother of several children suffered the most severe depression and despondency about a month after giving birth to perfect children. She tried the tincture of simicifuga, and after 8 or 10 days, her condition had completely changed. She had good energy, good spirits, zest for life. She continued taking it for 6 or 8 weeks and prescribed it to other depressed new mothers with equal success. Changing perceptions of menopause, which is increasingly seen as a normal life cycle transition, for which natural and folk remedies are more appropriate than mainstream medical interventions, coupled with increasing concern about the risks of breast cancer associated with female HRT, had led to widespread self-prescribed use of black cohosh, among other agents, as a replacement for HRT. Practitioners familiar with botanical therapies use black cohosh in formulations to assist tapered withdrawal from HRT. It is also used to facilitate transition from combination regimens of conjugated estrogens and synthetic progestins to lower doses of safe, bioidentical HRT protocols using estriol and natural progesterone. Black cohosh is rarely used alone in this context, but rather is used as one ingredient in a formula addressing the specific needs of the client. Black cohosh loosens and expels mucus and phlegm deposits from bronchial tubes of the lungs and stimulates the secretions of the liver, kidneys, and lymph system. It has a stimulating effect on the secretion of the spleen, liver, and lymphatic system. Black cohosh acts as an antispasmodic in cases of severe cough, such as in bronchitis or whooping cough. It will relieve children's colic, convulsions, and spasmodic nerve troubles. Black cohosh has been used successfully to relieve rheumatism. In the late 1800s, it was a leading medicine for this type condition. Some herbalists believe that the herb relieves the heavy, aching pain, but does not correct the condition, which is sometimes exquisitely sensitive and acute, which may require further treatment. A poultice of the plant can be used for all kinds of inflammation as it equalizes blood pressure. Black cohosh is a mild cardiac tonic, especially for fatty hearts. It will slightly lower the heart rate while increasing the force of the pulse. When there is a weak, irregular heartbeat, black cohosh gives slowly increased power to the heart and a rise in arterial pressure. When the pulse is either too fast or too slow or skips, black cohosh can help relieve the symptoms, even in children. It is considered as effective, but not as potentially dangerous as digitalis. Black cohosh has a strong influence on the muscular system and is used for various forms of rheumatism, arthritis, and neuralgia. In cases of pain, such as headache and bone ache that accompanies measles, scarlatina, and smallpox, black cohosh is very valuable. When there is pain in the digestive system, where the walls of the stomach seem to be contracted in a hard lump, black cohosh can relax and relieve the pain. Non-medical uses. Black cohosh's only non-medical use seems to be that of a natural insect repellent. It might be used to keep unwanted insects away from homes, sprinkled near doorways or in troubled areas. It would be interesting to experiment with it as a fly and mosquito repellent in the form of a mist or spray. Research. It has long been believed that black cohosh is an effective tonic for the uterus and female organs because it contained estrogens. However, recent studies have called this belief into question. More recent research indicates that extracts of black cohosh do not bind to the estrogen receptor, upregulate estrogen-dependent genes, or stimulate the growth of estrogen-dependent tumors in animal models. Additional experiments have demonstrated that black cohosh does contain compounds with anti-estrogenic properties. The bottom line is that science doesn't truly understand the plant's actions on the estrogen receptors in the body, or how it affects the female reproductive organs. A wide range of clinical studies have used extracts of black cohosh, specifically remifemin, which is a 1-to-10 extract that is marketed as an alternative to hormone replacement therapy, otherwise known as HRT, for women. One critical review concluded that clinical benefit had not been convincingly demonstrated in quality trials, but that a central effect or an estrogenic effect could not be ruled out. Another critical review of the effects of black cohosh on menopausal symptoms in women concludes, evidence for black cohosh is promising, albeit limited by the poor methodology of the trials. The traditionally known affinities of black cohosh for the nervous and musculoskeletal systems, its cardiovascular effects, and the broad scope of its gynecological indications increasingly appear to have an underlying basis in the neuroendocrine pharmacology of the herb, although this awaits further study. A recent comprehensive safety review by Low Dog et al. Analyzed uncontrolled reports, post-marketing surveillance, and human clinical trials of more than 2,800 patients involving black cohosh. The trials demonstrated a low incidence, 5.4%, of adverse events, of which 97% were minor, and none resulted in discontinuation of therapy. No severe events were attributable to the herb. The authors of the study concluded that black cohosh was safe when used for menopausal symptoms and is a safe alternative for women in whom estrogen therapy is contraindicated. Overall, the pharmacodynamics of black cohosh are complex and not fully understood. The focus on menopause may have detracted from wider considerations. For example, black cohosh compounds are chemoprotective against menadione-induced DNA damage. The model of black cohosh emerging from current research in many ways is more coincident with the traditional picture of the remedy as a neuroendocrine rather than a hormonal agent. In its assessment, the Committee on Herbal Medicinal Products considered around 20 clinical studies involving over 6,000 patients who received black cohosh. The results of the studies taken together indicate that black cohosh improves menopausal symptoms. Research on black cohosh in horses is limited and inconclusive, with some studies finding no significant benefit, while others suggest potential use in managing nervous behavior or as part of treatment for equine Cushing's disease, PPID, though other herbs like chasteberry are often preferred for PPID. Herb-drug interactions. Black cohosh therapeutic monographs typically do not identify any drug interactions. The herb is relatively safe and is well tolerated with minimal toxicity at therapeutic doses. Veterinary uses. Black cohosh is not commonly or routinely used in veterinary medicine. Possible uses of the herb would be helping mares who become irritable, difficult behavior, or mood swings during their estrus cycle, osteoarthritis, bronchitis, and coughs. However, for horses, there are herbs that are more commonly used for the mentioned conditions. Black cohosh can be and is commonly included in herbal formulas designed to help calm anxious horses and to help horses focus. There are also formulas that utilize black cohosh that are formulated to help horse deal with stress. It is commonly found in combination with other herbs, such as chaste berries, valerian root, and dong quai, for a comprehensive effect on hormonal balance and calming. Black cohosh should not be used in mares during the third trimester of pregnancy. In any case of veterinary use, I would not suggest giving the herb to the animal for more than 6 months at any given time, and only small doses should be used. In any case of veterinary use of black cohosh, you should consult with your veterinarian before administering to your animal. Cautions: if you take too much black cohosh, it will produce a severe frontal headache with a dull, full, or bursting feeling. This headache can be used as a gauge to determine the correct dosage of the herb. This herb should be taken in small doses. If a small dose of this herb does not remedy the issue, you may need a different herb to address the issue you are experiencing. The herb is a very potent agent, and an overdose will produce nausea and vomiting. An overdose can also produce vertigo, impaired vision, trembling, dilation of the pupils, prostration, and reduced pulse. Published reports in Herbalists have described cases of hepatotoxicity with long-term use in women. The main effects with long-term use have been mild to severe joint pain or headache, elevated liver enzymes, and adverse reactions in the liver caused by interaction with statin drugs. Despite the apparently benign toxicity of the herb according to the clinical trial data, there have been persistent anecdotal reports of hepatotoxicity linked to black cohosh consumption. A recent National Institutes of Health (NIH) workshop discussed such reports and concluded that at present, hepatotoxicity has not been conclusively demonstrated, although vigilance, including liver functioning monitoring, may be appropriate when higher doses are used. Black cohosh should not be taken during early pregnancy, except in combination with other herbs. It can be used for the final weeks of pregnancy, but only to ease and/or induce labor. If you decide to utilize black cohosh, you should start by taking small doses, no more than 2 to 3 capsules per day. Black cohosh is an herb that is more suitable for short-term use and should not be taken for more than 6 months at any given time. Thank you for joining me for today's discussion on black cohosh. I hope you found it interesting and learned a little bit about just how wonderful this herb is and its various uses. Next week, I will discuss black walnut. I hope you take time to tune in next week for that discussion. As always, this podcast is for educational purposes only. The information contained in this podcast is not intended or designed to treat, cure, or prevent any illness or disease. This podcast is not designed as a substitute for advice from your medical provider, veterinarian, or other qualified healthcare professional.